Are you worried that you might be experiencing the symptoms of pelvic organ prolapse? Are you feeling a bulge or a heaviness in the vagina? Are you having trouble with bowel movements or bladder issues? Maybe you're feeling heaviness, achiness, or pain in the pelvis. If you're experiencing any of these symptoms, there's a chance that you may be experiencing pelvic organ prolapse. My name is Dr. Brooke Kalisiak. I'm a pelvic physical therapist who is passionate about helping women overcome their pelvic organ prolapse symptoms. And today I'm going to be talking to you about 10 signs and symptoms that put you at risk for pelvic organ prolapse. Did you know that some research shows that upwards of 50% of females may experience pelvic organ prolapse at some point in their life? This is a staggering statistic and frankly is quite scary. For many women, they may not even realize that prolapse is something that can potentially happen to them. Pelvic organ prolapse is a generic term that describes the falling in of some of the pelvic organs into the vaginal canal. So it could be that the bladder tips backwards, or the rectum tips forward, or the uterus starts to come down. The symptoms can be wide and varied. It can be a feeling of pressure, heaviness, or fullness in the pelvis. It can be a bulge in the vaginal canal. It can be a change in sexual function, bowel function, or bladder function. You might also experience low back pain or hip pain. The symptoms are highly varied among the individuals who experience prolapse. And honestly, for some women, they can be debilitating. But today I want to talk about some of the risk factors to consider that can help you mitigate the chances that you might experience prolapse in your lifetime so that you don't have to go through these debilitating symptoms of pelvic organ prolapse. Here are 10 risk factors for pelvic organ prolapse and what you can do about them. Number 1, constipation. If you are chronically constipated, that is going to put a lot of downward pressure through the pelvic floor area when you are straining to have a bowel movement. So if that's the case for you, we want to figure out what's causing that chronic constipation and get you to have smoother bowel movements without having to strain. This might mean evaluating dietary changes that might help. We might want to evaluate the pelvic floor to make sure that's relaxing the way that it should be. We can do changes in positioning on the toilet to help with bowel movements. One of my favorites is getting your knees up above the hips and using something like the squatty potty to do that. So if you are dealing with chronic constipation, that can put you at greater risk for developing pelvic organ prolapse at some point in your life. Risk factor number 2 for pelvic organ prolapse is repetitive heavy lifting. Now let me clarify. We as women should be lifting heavy. I am a huge proponent for women lifting weights. But unfortunately, many people are not taught how to lift heavy weights well, and unfortunately do a lot of breath holding and straining to do that heavy lifting. So if you have a job that requires you to do a lot of heavy lifting and you are chronically holding your breath and straining really hard and putting all that pressure down through your pelvic floor, over time that can wear out the support mechanism and you can potentially end up with prolapse. So I recommend partnering with someone to help you teach you good lifting mechanics that involve how we activate through our core and pelvic floor properly to lift. My simple tip for that is to think about exhaling with exertion. That helps to release the pressure out the mouth versus putting the pressure down through our pelvic floor when we lift. That is a very simple explanation, but it can help a lot of people minimize the amount of pressure that they put down through their pelvic floor, helping them to protect against pelvic organ prolapse. Risk factor number 3 for developing pelvic organ prolapse is constant abdominal gripping. Many women have been taught from a young age to constantly hold in through their tummy so that they stand tall and they look good. When we are constantly gripping in the midsection, that puts increased intra-abdominal pressure through this area, and pressure has to go somewhere. And when we're upright, pressure is going to go down because of gravity. So if we squeeze in here constantly throughout the day just gripping in our abs, never letting go, that is going to put extra pressure down through the pelvic floor area and can put us at greater risk for developing pelvic organ prolapse. So if you find yourself constantly holding tight in the abdominal muscles, you need to relax and let them go. Now, I'm not saying that we stand there all schlumpy with a beer gut, but we are not designed to hold tight through here all day long. We need to let that abdominal wall be able to breathe and move. Risk factor number 4 for developing a pelvic organ prolapse is carrying extra body weight on your frame. Now, don't get me wrong. Skinny women can develop pelvic organ prolapse as well as women who are overweight. But it is a little bit more likely that you might develop prolapse symptoms if you're carrying extra weight, because that is extra work that the pelvic floor has to do to help support things up and in throughout the day with our activities. So there have been research that has shown that even losing a very modest amount of weight can help to eliminate some of the pelvic organ prolapse risks, or if you're already experiencing prolapse, can eliminate some of the symptoms. Again, your weight is not the only causal factor for developing pelvic organ prolapse, but it is one of the risk factors that you can modulate. Risk factor number 5 for developing pelvic organ prolapse is hitting menopause. So menopause is the cessation of our period, and it is a time in our life where our estrogen levels drop significantly. And because of this, our tissues, especially in the pelvic area, lose some of their elasticity. And this can mean that they are not as good at reacting and absorbing forces down through them. So once women reach menopause, that is a much more common time frame for them to experiencing pelvic organ prolapse symptoms. And we can't stop menopause from happening. That is going to happen to every woman at some point in their lifetime, usually around age 52 or later. But what we can do is make sure that we have optimized our pelvic floor health and muscle function ahead of that time so that we mitigate the changes that occur with the drop in estrogen. Risk factor number 6 for developing pelvic organ prolapse is long-term participation in high impact activities such as running and jumping, plyometric activities. Again, I want people to be active, and I think running and jump rope and plyometrics can be a wonderful way to improve our fitness level and to be active. So I by no means am saying women shouldn't run or women shouldn't jump. What I am saying is that we should make sure that our form is doing well and that our muscles can handle the loads that we're talking about. So this might mean partnering up with a personal trainer or a physical therapist to make sure that the muscles of our abdominal core, hip, and pelvic floor area are working the way they should be to be able to manage the high level of stress and load that happens in running activities or jumping activities. This is one of those things where I see a lot of postpartum moms coming back to running or plyometric activities too quick, and they end up having pelvic support issues because of it, because they haven't rehabbed their core and pelvic floor to be ready to hold on to or support that higher level of stress and activity. Risk factor number 7 for developing pelvic organ prolapse. Are you a chronic cougher? Do you have some type of lung issue like COPD or emphysema? Have you been a smoker and now have developed a cough with it? If you are chronically coughing, that is a lot of downward stress through the pelvic floor, and it's very hard to mitigate that issue. It is normal, we all get coughs and colds throughout our life, and our pelvic floor can react and respond to that. But if that's happening day in and day out, that is a lot for the pelvic floor to be able to resist back against, and over time it may not be able to deal with that issue. So dealing with the underlying chronic cough can help to take away this risk factor. Risk factor number 8 for developing pelvic organ prolapse is connective tissue disorders. So many people might be experiencing some type of connective tissue hypermobility issue. A common disorder is Ehlers-Danlos syndrome, or EDS for short. This just means our connective tissue is more hypermobile and has a lot more give and laxity to it. So this can affect everywhere in our body, including on our pelvic organs and the ligaments that help to support them up and in. And so therefore, if you have this condition simply by having this connective tissue issue, you are in a higher risk category. There's not much you can do about it to change that other than to be aware that it puts you in a higher risk category. And it's of the utmost importance that you make sure that you are optimizing your muscle function in the core and pelvic floor area to make sure that you have the best support there as possible, because we can't change the connective tissue hypermobility that's there. Risk factor number 9 for developing pelvic organ prolapse is your genetics. Now, unfortunately, we are dealt the genetic card we are dealt, but it is possible to be a little bit more aware of your risk if you interview your female family members, like your grandma, your aunt, your mom, to see if they have experienced pelvic support issues or pelvic organ prolapse issues in their lifetime. If you know that your mom, your aunt, your grandma, your sister have experienced these issues, there is a higher likelihood that you may experience these issues. And again, it's of the utmost importance that you think about optimizing how you're using your core and pelvic floor to create the best support possible for your pelvic organs to mitigate this risk. Risk factor number 10 for developing pelvic organ prolapse is probably the one most of you have already thought about, and that's pregnancy and childbirth. When we are pregnant, that puts a lot of extra pressure and stress down through our pelvic floor, as does childbirth itself. Whether it's a vaginal delivery or a C-section delivery, both of those have their own risk factors associated with it and can affect the support and the ligaments and the muscles in the pelvic area, which can eventually potentially affect whether or not we end up with a pelvic organ prolapse. So when women get pregnant and deliver babies, that does put them in a higher risk category for developing pelvic organ prolapse, but it's not a given that it's going to happen. The good news is there are things that you can do to make sure that you optimize your pelvic floor health to minimize the risk of developing pelvic organ prolapse. So did any of these 10 risk factors for pelvic organ prolapse surprise you? Hopefully not. Hopefully you were familiar with some of them, but now you might be a little bit more in tune to what you can do to make changes in your lifestyle to hopefully mitigate your risk for developing pelvic organ prolapse. I'm sure you saw a common theme throughout these risks, that partnering with a pelvic physical therapist to optimize your core and pelvic floor muscle engagement might be your best way to make sure that you are minimizing your risk for pelvic organ prolapse. So if you have further questions, drop them in the comments. Check out some of our other videos about pelvic organ prolapse, the different types, what you can do about them, how to recover from surgery for pelvic organ prolapse. We have a whole host of education material about pelvic organ prolapse because we want to make sure that you feel armed with proper education to optimize your pelvic health.